more rapid than eagles, and bits no larger than bites. Helping you protect yourself from Mr. Painful Blister since 1842, this is Quick Zips, the late night edition. Sexuality education fast.
I'm Galena Mines, and welcome to our show. Inquiring minds want to know, and you folks inquire a lot. Many viewers have asked us questions about reducing risks. So today, we'll talk about how can I reduce my sexual health risks related to STIs. The short answer? Avoid any and all sexual activity. That is, be abstinent. Being abstinent is the only 100% way to avoid STIs in pregnancy. In fact, although it may feel like many young people are having sex, this really isn't true. Most kids your age report they are not having sex. They frequently say they are not ready for the emotional, physical, and social consequences of sex. However, if a person is sexually active, then they should always use a new latex condom for any sexual contact and get tested regularly for STIs and other infections. That is, practice safer sex. The long answer? When it comes to sexual health and sexual health risks, it's not who you are that makes a difference, but what you do. In other words, reducing risk is all about your behaviors and the actions you take to reduce your risk. Imagine 3 people who are pretty much the same in terms of where they live, their grades, friends, activities, and social status. The first person is not and has never been sexually active, doesn't use needle drugs or any other drugs for that matter, and doesn't drink. The second person is in a sexual relationship with one partner, was tested for STIs, and always uses a latex condom for all sexual contact, never uses drugs or alcohol, has talked about sexual health with a partner and with a healthcare provider, and knows that the partner has too. The third person has multiple sexual partners and sometimes uses a condom for sexual intercourse, but not for any other types of sexual contact, occasionally uses drugs and alcohol at parties, has never been tested for an STI, doesn't know whether partners have been tested, but feels fine. Clearly, these 3 friends have completely different sexual health. They're very similar, yet their behaviors make their sexual health very, very different. Let's look at why. Staying sexually healthy really involves 3 things. Completely avoiding STIs, reducing risk of infection, and being sure you don't have an infection. As you may know, STIs are primarily transmitted through the exchange of body fluids and direct skin-to-skin contact, and sexual activity is one of the main ways that happens. Person 1 understands that the surest way to stay healthy is to avoid risk altogether. You do that through abstinence from all risk behaviors. No sex, no drugs, no tattoos, and so on. That means no sexual contact of any kind. No penile vaginal sex, no oral sex, no anal sex, no manual manipulation, that is, touching other people's genitals. Hugging and kissing is usually okay. You can't usually get an STD from swapping saliva. However, if you are infected with herpes or syphilis and have sores on your mouth, you could pass the infection to your partner through kissing and through oral sex. If you choose to be sexually active like persons 2 and 3, then the best way to reduce your risk is to always correctly use a latex condom. Have only one partner. Get tested for STIs prior to having sex. Person 2 clearly gets it. Person 3 doesn't. So let's break it down a bit. If you are going to be sexually active, you need to use a condom for all sexual activity, every single time. Oral, anal, penile, vaginal, each time. Every time. No exceptions for forgetting. No exceptions for being buzzed or horny. When you get condoms, make sure the package says that they may be used to prevent STIs. The most common kind of condom, latex, definitely works. If you or your partner is allergic to latex, then polyurethane condoms are a good option. However, other types of condoms made from natural materials, sometimes called skins, are not as effective at stopping STIs, including HIV. You can get condoms in stores that have a pharmacy and a lot of other places as well. One partner means that you and your partner are only seeing each other and having sex with only each other and not anyone else. Having only one partner ensures that neither of you bring anything special, like an STI, into your relationship by having sex with someone else. Getting tested can help ensure that neither of you have brought something special into your relationship from a previous relationship. So, if you break up with somebody, Getting tested before you get involved with someone else can make sure you get off on the right foot. Get the test. It's no big deal. You can go to your doc or to a clinic. It's private and generally painless. So, if you're sexually active, you should always use a latex condom. Stay with one partner and get tested, both you and your partner. Anything less than this can negatively affect your sexual health. By the way, some people say that condoms are not effective. This is misleading. Condoms are not as effective as abstinence, but when condoms are used consistently, that means every time you have sex. And when they are used correctly, that means checking the expiration date, putting them on and taking them off correctly. They are up to 95% effective in preventing STIs, including HIV. And they protect against pregnancy too, which is a nice bonus. And that's what we call safer sex. By the way, I call it safer sex instead of safe sex because the only 100% safe sex is no sex at all. Since many STIs are transmitted by body fluids, another way to reduce risk is to avoid sharing items that carry body fluids, such as intravenous drug needles, sex toys, and needles used for piercings or to make tattoos. And another thing, anything that makes it more likely that you will do something risky should be avoided. Alcohol and drugs, for example, can make you more likely to take risks you wouldn't normally take. That's it for this segment of Quick Zips, the late night edition. Remember, the surest way to reduce risk is to be abstinent. If you don't engage in any type of sexual activity, you likely won't get an STI. If you are sexually active, then the surest way to reduce risk is to practice safer sex, including the correct and consistent use of latex condoms in an infection-free, monogamous relationship. Be safe. See you next time.
This episode of Quick Zips is brought to you by the Blue Streak, who would like to remind you to use a latex condom. Use a latex condom. Every time, every time. And be sure to check out his new show, Top 10 Condom Errors, the follow-up to his smash hit, Top 10 Stupid Condom Tricks.